Before we begin today's business meeting, we have a very special guest with us today. Minister Adrian Dix has been the Minister of Health since July of 2017, and I imagine that neither he nor any of us would have imagined it would be such a chaotic few years. On behalf of all dental hygienists, I want to thank the Minister for finally signing through the changes that were needed to abolish the 365-day rule and bring the dental hygiene profession into the 21st century. This is something that dental hygienists in this province waited a very long time for, decades actually, and we're really pleased to have you here with us to mark that occasion and also to extend our appreciation for the work that you and Dr. Bonnie Henry have done over the past year and a bit, particularly your trust in having dental hygienists become COVID testers and immunizers. As a profession, we are so proud that we have been able to step forward at this time in history and contribute to the solutions needed to help get BC back on its feet. So with that, I'm so very honored to introduce Minister Dix.
I wanted to thank Aileen for her extraordinary prayer and welcome. I think I'm in East Vancouver on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nation, and I think particularly in this week, but in this time, where, and these are challenging times in societies, where we desperately need to address both what has happened and listen and understand what has happened in our history. And the events in Kamloops underline this, but they are not, they are profound and they are troubling and they are tragic, but they are not used in the sense of what we understand from our history. We have to keep learning and doing better, and it's really difficult, I think, in these times. I just want to say this with respect to the pandemic, and because we're talking about this in terms of all people in the province. One of the things that I think I am proudest of, and I'm not proud of it personally, but I'm proud of it in terms of the leadership of Indigenous peoples in our province, is the delivery of vaccinations in Indigenous communities that was led by the First Nations Health Authority, an Indigenous-led organization, and has been exceptional. And we have seen, in fact, the decline in transmission of COVID-19 in those communities now for months. We've seen it more recently in the last few weeks, but it reflects, I think, what we need to do in our society, which is change the power dynamics. There's frequently a discussion of what programs we need to offer and what we need to make, but we also need to change the power dynamics in our society, and having First Nations healthcare leaders lead our pandemic response in Indigenous communities has made an enormous difference. And it's one of the things that I hope as we come through this moment in our history, this moment of pandemic, one of the lessons we learned, and I think there are other ones as well. I think in our society, one of the reasons I think we've done comparatively well in BC, not well, because many people have lost a great deal in the pandemic, but comparatively well, is a preparedness to work together, a fundamental understanding of the value of public health care. We've been in a year where just about every business in our country has received through some means, some form of collective aid and support, and we have supported one another in a difficult time. And this is something there will be, of course, once we emerge from this, which I hope we will do, there'll be a desire to forget all the things we've done together. But I think one of the most valuable things in healthcare that we've done is worked well as teams. And I appreciate very much, Mandy, your comments about the change in oral health regulations and what they mean for patients and what they mean for those needing dental care and the ready access to dental care, the ending of ridiculous rules like the 365-day rule. It seemed like it's frustrating, of course, because one seems like one's fighting a long time to get rules which really made no sense in the first place. But I think those rules and those expanded scope of practice and the acknowledgement of the work of dental hygienists, the quality of that work, their understanding of healthcare and the value that they bring. And we've reflected that, of course, in the COVID-19 testing and the delivery of immunizations as well. I think that team-based care, the fact that it's not one singular dentist or one singular doctor, but a team of people across healthcare providing care that has been essential to our pandemic response. And I think it speaks well of what we can do together in the future. All of you will know that I believe powerfully in this, and we are making some significant changes as well into the future in terms of the way we regulate health professions, including yours. And we're reducing, as you know, it's our intent to reduce the number of health professional colleges. Our desire in your case, and the provincial the colleges in dental care are coming together, because I think that the silos that have existed between professions in fact, have limited the value that so many professions can bring to the team. And I think we're going to see positive changes as a result of all this that we've had, and in healthcare, as everything else, a more hierarchical approach than is valuable in the way that we deliver services. And so, and you know, we did, and a review, as you know, of the College of Dental Surgeons a number of years ago that led to this process of reform. And one of the things that review showed is how little the colleges spoke to one another, the professions spoke to one another, and we need to break down those silos. And that doesn't mean that your organization will become less influential. It means it will become more influential, and we need it to. And that professions will become less influential, they'll become more influential. The strength that we can show and the effectiveness and the credibility of dental hygienists is very high in our society. You no doubt as an organization from time to time poll on this question, so you understand this, this as a collective response, but I think as an individual response, we have to acknowledge that. So these are changes that have come out of the pandemic that we have to build on. There will be a desire to move past this, you know, to forget it, to have a big celebration, as my colleague, Dr. Henry says, perhaps a National Hug Day. But there also will be a need, I think, for us to reflect on what we've learned. Because, well, many people have described this period as unprecedented. Of course, it's not. My grandmother was a nurse. Her first days in nursing, graduated to become a nurse just after World War I. Her first days in nursing, her first years in nursing, were spent dealing with what's sometimes called the Spanish flu, but the influenza epidemic of the post-World War I period that had such a profound effect on our planet and our lives. These are not new things. And so we have to learn these lessons and come out of this pandemic understanding how much we mean to one another, how important building a sense of team and solidarity in society is, and how everyone plays that role. Finally, I want to say that I think that we're also entering a period where there's going to be a national debate about dental care and its value. And we, as a provincial government, have addressed this in the ways typically we have in the past, in trying to ensure that those especially who are without dental care have access to such dental care programs such as Healthy Kids. As Minister of Health, I gave priority to two areas in our surgical plan. One was hip and knee replacement, the other was dental surgery, because so many people were waiting so long, particularly many people who could not express their pain, who required general anesthetic to get dental procedures done. Some of them, many of us would describe as basic. So the central role of dental care to human health has been known for a long time, but I think it is going to be a more significant part of our public debate. And I look forward to your organization playing a real part of this. So congratulations. That's a long, welcoming statement. So I'm going to leave it there, but I want to congratulate you on your 57th Annual General Meeting with 4,000 dental hygienists across the province, the 157 who are with us on a Saturday morning. Congratulations for that. That shows a strength of organization, because it's a pretty nice Saturday morning here in Renfrew Collingwood in any event. And so I want to congratulate you. Thank you for all the work you do. Thank you for your remarkable work during this pandemic, both for your patients in dental care and for everyone in the province. And let's keep working together to ensure that dental hygienists have the broadest possible scope of practice and can continue to contribute and lead in the healthcare system, not just be a profession in the healthcare system, but lead in providing better dental care for people. Thank you. And thank you for having me this morning.
Thank you, Minister Dix. I mean, I've met you so many times, but I always enjoy listening to you, and today was no exception. And I know our profession is very much looking forward to continuing to work with government to enhance both the access to care for all British Columbians. I'm not sure how much time you have with us this morning, Minister Dix.
I'm good. I'm good
now
that my sound works. I'm really good.
Yes, the technical glitches, we had it this morning too. So you're not alone.
That's me. I always have technical glitches. It's great.
Yeah, I always say it's opportunity for some humor. So we do have some questions that were submitted by our members. So thank you for staying to answer them. I'll start with the first question. You kind of touched on it a little bit. I warn you though, it has 3 parts, but it's important because it's on the mind of many dental hygienists, if not most. So can you tell us how soon you think the amalgamation of the oral colleges will happen, and how you will ensure that one group, like the dentist, don't end up having authority over the rest of us? And how do you see it working when often dentists are the employers of dental hygienists, and that can be used sometimes against us?
I think it's going to happen soon. The colleges, these are self-regulating colleges. So there's two processes going on. One, there's a process amongst these 4 colleges to come together. And that work is being done, and we'll have to name, they'll have to decide, and all of the professions will have to decide on the name of the college, and then that process will go forward, and I expect it to be approved. There's that process, and then there's a broader review of the health professions. So, sometimes people, I forget what the expression is. There used to be, I sound like I was watching too much Gunsmoke or Bonanza when I was young, but I'm not really that old. But this is a process that we are insisting upon, that there be a reduction in the number of health regulatory colleges. And inevitably, that's going to force regulatory colleges to work together. There's going to be a public component, first of all, so publicly appointed people who are going to be recommended based on their abilities and their skills and their experience, not on what has traditionally been political factors. I think sometimes in the public spots on health professional colleges, there's going to be fewer of them, so those positions are going to be more important. So you're going to have half the members be public representatives, and then the other members on the college shared between the different professions. And that is going to force all of the professions, because nobody is going to have anything approaching a majority, to work together. And I think for an organization such as the dental hygienists, but as a profession, I should say, as an organization, because these are, of course, the independent regulatory colleges, I think that the role of dental hygienists is going to increase, not decrease, in that approach, because you have a greater experience of working with all of these other professions. And I think even perhaps the College of Dental Surgeons, which has been to some degree an island unto itself. And some of those concerns were reflected in the report that many of you may have read, right? So I actually think that that's not going to happen, that whether everyone likes it or whether anyone doesn't like it, for me anyway, if anyone likes it or doesn't like it, everyone's going to have to work together. No one's going to have anything approaching a majority on the college board. And so that's going to force cooperation. Hopefully we don't need to force cooperation, but it's going to force cooperation amongst the professions. And that means that everyone, of course, has to give a little bit, the greater good, but it won't be giving just to the former members of the College of Dental Surgeons, but to that group, which will have some of its own issues, but will need to collaborate, but also dental technicians, dental hygienists, and denturists. And then we'll have to consider the role and consider the role, for example, of certified dental assistants. But this is not a repetition of the current situation in the College of Dental Surgeons, where the CDAs are part of really what's the dentist college, right? So it was mimicking the work situation, if you will, of the profession. In this case, these are equal representatives in a college that is regulating all of the dental professions together. And I think that will be a good thing for everybody.
Thank you for that. And I think that is exactly what we wanted to hear. So thank you for sharing that. I'm going to turn the screen over to Susan Smits for the next question. And she's somebody, Minister Dix, that you'll probably get to know well, as she is going to be our new incoming chair for the British Columbia Dental Hygienists Association, effective today. So Susan.
Thank you, Mandy, for that introduction. It's my great pleasure to meet you today, Minister Dix. My question is about the province's surgical renewal plan. Pre-COVID, the wait times for young children with severe dental decay averaged 26 weeks. I'm wondering how daycare surgery access will be championed as pain and infection for these children has been amplified during the pandemic.
Yes, and as you know, we put forward the surgical plan for the province after I became Minister of Health, and noted that dental surgeries is a priority, and we saw a very significant increase, both a decrease in average wait times in advance of the pandemic, and an increase in the number of surgeries. And you do that in the healthcare system by ensuring that there's adequate time. One of the challenges we face, and as you know, is that the overwhelming majority of dental work takes place in dental offices around the province, and not obviously in the public healthcare system or in hospitals. So the key is to how do you direct that in such a way that you're not dramatically expanding or moving surgeries that previously existed in one place to another place, but genuinely getting at the need. And that's one of the things that we'll certainly be seeking your advice on in the future. In other words, procedures that might well have taken place in a dentist's office, now that we've made more time available in the public system, will just get moved there. Right? And we don't want that. What we want to do is see a reduction in wait times. There has been an increase in the number of people seeking dental surgery since we increased eligibility. That's inevitable, because when you have wait times of 30 or 40 weeks or 50 weeks or 2 years or whatever they were in some cases, people sometimes get discouraged and they just take themselves off the wait list. When you provide more surgeries more quickly, it presents a real problem. So we had double-digit increases in surgeries in terms of percentage, but not double-digit reductions in wait times. So more people were getting surgeries, and we're going to continue to do it. Surgical dental surgeries often can happen in the acute care system for different reasons, but often for people with developmental disabilities, as you know, who really can't get the surgery with a local anesthetic. I think are a real are a priority, were a priority for me, and they were one of our first two priorities along with hip and knee. They are a priority now. We're going to continue to seek to reduce those wait times, because in some cases, it's wait times for people who are suffering with dental problems that they cannot properly communicate as well. And this has led to, I think, excruciating pain for long periods of time that would otherwise be unnecessary. So it's a priority. We're going to maintain it as a priority. I think there's ways that we can do it better, working with the professions to ensure that the people who need care get that care, and that we continue to be able to offer care for many people, for example, with developmental disabilities, who get served in your offices every day, in private dental offices every day. So we've got to find a way to do both. But the numbers are impressive of what we achieved in the first couple of years, and even in the last few months, we've seen since we really relaunched surgical renewal, we've seen an increase in the last 12 months, even in the pandemic, in the number of dental surgeries in the acute care system as we responded to the cancellation of surgeries. So I'm optimistic about it. It's an absolute priority for us. It's going to continue to be amongst procedures one of the lead priorities in terms of reducing wait times. And I know for those of you who care so much for patients and often treat patients who are vulnerable and need access to acute care services, I know it's very important for you as well.
Thank you. We look forward to being part of that solution. It's now my great pleasure to pass the baton to our Kootenay board member, Jan Kuzen.
Good morning, Minister Dix. This question arises out of the combined effects of employment status and reduced income due to COVID-19. Specifically, recent changes in the ministry dental benefit coverage for Healthy Kids program that is linked to income. When Healthy Kids was tied to premium assistance for MSP, the dental benefit was triggered with a change in income status at any time during the year, as is the case with daycare. Currently, eligibility for supplementary benefits, including Healthy Kids, is based on filing up-to-date tax returns, which are once per year and do not account for changes in the interim. The government did not adjust for this, and COVID has only made the situation more dire. Given the combined effects of reduced access to dental care, a 12% increase in candy sales, and a lack of coverage for the most vulnerable, I ask you, Minister, is this issue being addressed given the importance of oral health in the overall health picture? Thank you.
Thank you. And I would say this is an issue that we're looking at. We've made adjustments in other areas, as you may be aware, Jan, particularly with respect to pharmacare, where we had these possibilities in place where the assessment of income changed. As many people know, we have an income-based pharmacare system. So we made significant changes. We made it much easier for people to change or appeal that tended to be based on previous 2 years' income for pharmacare. So this is something that has been brought to my attention by the association, and I'm going to take a look at it. It's not directly in my ministry's responsibility. As you know, Healthy Kids is in another ministry, but it's an interesting point. As for the candy sales question, I hope some of these things are going to get improved once the pandemic is over. But we've got a whole bunch of work to do on a whole bunch of public health initiatives that aren't the ones that we traditionally have gone after to improve public health, and that includes, of course, sweetened beverages. That includes candy. That includes things such as, of course, tobacco and vaping and so on. So I appreciate you bringing it to my attention, and I'll take a look at it and get back to you.
Thank you to all the members for submitting questions for Minister Dix in advance of the meeting. And a warm welcome for being with us today, Minister Dix. On behalf of all dental hygienists in the province, thank you for the incredible work you've done to steer BC through these incredibly tough times. And dental hygienists, I just have to say, will forever remember that it was the NDP party, and specifically you as the health minister, that had the fortitude and the guts to really abolish the regulations that held dental hygienists back for decades. So please accept our gratitude for the work that you do and for being with us here today. Thank you.
Thank you very much. And I appreciate, when you're in politics, you always appreciate getting credit for things. I just say that was a victory won by the hard work of the BC Dental Hygienists Association. That's why those regulations changed. Dental hygienists around the province made the case, and that shows the value of your work. I was the person who signed off on it, but yeah, this group was a group of people who made that change happen. So thank you so much appreciation, and thank you for having me today.
You are most welcome. All right, thank you.